Hi, everyone. Welcome to Journeys with PDA Coffee Chat podcast, where we seek connection, community, and co-regulation while discussing all things PDA. Hey there, this is Heather from Journeys with PDA. Just wanted to give you a heads up for this episode. Sometimes we talk about tough stuff, and this is one of those episodes where we are going to be discussing some pretty serious topics. Sometimes those topics can be triggering to some people. They can be very difficult to listen to. One of the more difficult things that usually comes up when we put these trigger warnings out there is the talk and the discussion around suicide and suicide ideation. So we just want you to make sure that you are taking care of yourself when you start listening to this particular episode. And if you feel like you need to seek out mental health support, we encourage you to do so. Thank you very much. Hello, and welcome to Journeys with PDA Coffee Chat podcast. I'm Heather.
And I'm Kerissa. Today we are chatting with a very good friend of mine, Tricia Wagner. She is a licensed clinical professional counselor and licensed addictions counselor.
Our topic today is suicide and suicidal ideation. This is a very challenging topic, but we feel it's incredibly important to talk about. While you're listening, please be mindful of our topic and please make sure that you are taking care of yourself as you listen to this.
Thank you, Tricia, for chatting with us today. And go ahead and introduce yourself.
Okay, well, my name is Tricia Wagner. I am currently the Director of Outpatient Services at Shodair Children's Hospital. I have worked at Shodair since 2009. I've worked in both our acute and residential units. I've done outpatient work, and now I am currently the Director of Outpatient Services. So suicide and suicidal ideation is a topic that we address quite a bit in our clinic and with our patients.
Okay, so this subject is very important to me. It's very near and dear to my heart because this is something that I've had to experience firsthand with both of my children. As a parent, as a mother, it's so incredibly terrifying to hear your kids have these types of thoughts. It's really, really hard to understand. And I honestly feel like we are not having enough open conversations about suicide. And so that left me in a place of really panic. I didn't understand what was going on with the kids. I didn't know if they were safe or not safe, or I didn't know if it was like, do all kids feel like this? And so I think it's really important to have a conversation about what is the difference between someone who is suicidal and someone who has suicidal ideation, and maybe if you can also explain a little bit what is suicidal ideation for someone who maybe isn't familiar with that term, because I know before we experience this, that's not something that I knew about.
Yeah, so I think that the word suicide is just scary. It's just such a big buzzword. And so whenever a parent or really anybody hears the word suicide, it can just feel icky, and it can feel like something that we don't want to talk about because there's a real genuine fear that if we talk about it, then we might cause someone to think about it and thereby increase their odds of doing something. And that's not true at all. So suicidal ideation is actually just thoughts about suicide, and that is a very common thing. Lots of people experience at some point in their life thoughts of death and dying or suicide, and it can mean a lot of different things. And so, as a clinician, if somebody comes into my office and they say, I'm having suicidal thoughts, I say, well, tell me what that means for you, right? So it doesn't just mean that if somebody says, I'm thinking about suicide, that they have a plan and they have intent and they have access to carry out their plan. It could just mean, wow, I'm really overwhelmed. I've got a lot going on, and sometimes it would just be easier if I didn't wake up in the morning. So it's like a spectrum of thought processes, and it can be either passive thoughts, which means sometimes I think about it and it's kind of a passing thought. Maybe I'm just wondering about what it would be like to not have to deal with this anymore, but it doesn't last very long. And I don't kind of have an emotional attachment to that thought. It just kind of moves through me. So that's more of a passive thought about suicide. And then there's thoughts that can be considered active suicidal ideation. And so active suicidal thoughts and ideations means, wow, I'm really thinking about it a lot. It seems to be kind of at the forefront of my mind. It's really hard for me to not think about wanting to die, and kind of thinking about what ways I might, use to commit suicide, or wondering more deeply about what it would be like, for my family if I weren't here, or, just a lot more detailed thought process about not being here anymore. Especially when there comes to like having a plan or having like a date picked out, like that's very different than, oh, this is a really big thing. I don't want to feel like this anymore. I want this to go away. So I think that what people tend to do is they hear suicide and they automatically assume, oh, we have an active situation here where there's a plan, there's intent, and there's access to carry out the plan. And in reality, most of the time, it's more passive thinking about death and dying and not wanting to deal with this anymore. And so, I tend to talk with parents about, that it's okay to talk about it. And if your child is saying things like, gosh, I wish I just didn't have to deal with this anymore, it's okay to just come out and ask the question. Because really, it's part of our, language now. It's on the list of menu options for people to choose from anymore. It's talked about more. And so it's something that we have to start to become comfortable with, and really being okay with going there with your kids. And I think that when parents can tolerate that conversation, right? So when they can tolerate and manage their own emotional response to their child saying, I don't want to be here anymore, then the chances of your child continuing to talk with you when they're feeling that way are going to be better. So it's kind of like we have to desensitize ourselves to that word and what that means.
Mm-hmm.
So what are some of the ways that a parent, when they're at home and their kid is distressed and they're kind of like, I just wish I didn't exist anymore. And so that's the phrase that we heard in my house. I just wish I didn't exist. And so what are some of the questions that parents can maybe ask, or what can be their thought process in kind of being able to dig into this situation?
Well, I mean, I think it's important to just go right in and ask, what do you mean when you say that, right? Tell me more about not existing, because that's a really big statement, right? So you mean you don't want to be on the planet anymore? You don't want to be a part of this family? You don't want to exist because school's too hard? So I would just ask, define that for me. How do you define that for yourself when you say those things? What does not existing mean to you? Does it mean I just want to break, right? Like I don't want to exist in this house in the middle of whatever's happening here, and I would like to go to camping and have a break and have some space, right? So I think that's the most important piece, is asking, well, what do you mean when you say that? And then being okay with whatever that response is, because we don't know it could be a really shocking response. Like, no, I really mean it. I don't want to be on this planet anymore, and I just want to die, right? Um, we had to be prepared to hear that. But the number one thing is, okay, you're having a really big emotional experience. This sounds like it's feeling very hard for you, right? I think sometimes as parents, we tend to give them all the reasons why they shouldn't feel that way, right? I mean, I've done it with my own kids. Oh, it's not that bad. Like, you're fighting with your friend today, you fought with them last week, and then you were fine. It's really easy to kind of go to that place of like proving them wrong and why they shouldn't feel a certain way, instead of just joining them and saying, this is really hard for you. Whatever's going on for you is really, really big, and you're not feeling okay about it. Tell me what you mean by that, right? And so then I think once you get those responses, you can kind of gauge, what do they need from you in those moments, right? So, it sounds like you're not feeling really safe with yourself, and that you're kind of feeling all over the place. And that seems like it's scary, and it's scary for me as your parent. So I'm just going to make sure that nothing happens to you. I'm going to hang out with you. What do you want to do? Right? Should we go for a walk? Let's watch a movie, whatever. You can yell and scream, but I'm going to be here with you to make sure that it's safe. I think that that's really effective with kids, is knowing you can hang with them when they're in those dark places, right? Because we tend to do this, like, you don't feel that way. It's uncomfortable for you to be having this problem, or I don't have time for this right now, right? Like, God, could you pick an easier, maybe a more convenient time to have this big distressing moment? Because like 10 o'clock at night isn't working for me, right?
Right.
It's hard, and they just have to know that you can handle what they're going to say, and that it's okay, and that you're just going to be there so that you can make sure they're safe. So, I mean, I think those are the keys. The other piece of it is you have to understand that, adolescents especially are on an emotional roller coaster on any given normal day, right? So even if they're not having, a mood disorder or a spectrum disorder or, anything like that, like, it's hard on any given day. And so when you add all of these other pieces and the PDA piece, right? And, difficulty connecting and understanding and communicating and regulating, wow, that's a really big roller coaster to ride. But it's a roller coaster. It will come and go. And so you just kind of have to ride the wave. You have to just kind of go, okay, this is one of those big moments that I'm going to have to just ride it out with them. And it will come down. Sometimes it might come down in 15 minutes. Sometimes it might be 3 hours. It could be 2 days. But they just need to know that you're going to ride it with them.
So what are the signs that you have ridden it out with them, and then it's now safe to, leave the child by themselves, or, go on with your activities? What are the signs there that parents can observe to go, okay, we're in a safe place now. Now we can resume.
So I think that it can be a graduated process. And I think that you have to go with your parent instincts, right? So if there is anything inside of you that says, I'm not sure, then you're not ready yet. Okay. And so it could be, sometimes kids will very quickly turn it around when they know, okay, my parents aren't going to leave me alone. I really would like to be alone so I can carry out this plan. And so if they're really quick to turn around and kind of take it back, that would be a red flag for me. I would say, I hear you saying that. I think that you're telling me that it's feeling better, but I'm just not comfortable with that yet. Like, I just want to hang out with you a little bit more. And it can be a graduated thing. It could be okay, so I'm not going to sit with you in the living room anymore, but, and you can hang out in your room, but the door's going to remain open and I'm going to check on you and walk by every now and then. Right? So there's lots of different graduated steps you can take for observation with your child. But I would say if there's anything inside of you as a parent that says I'm not sure, don't risk it.
Yeah, that gut is so important. It's so important.
It is. And I tell parents a lot, suicide for some when they make an attempt is very final. And a lot of times parents are fearful of enacting a safety plan because they don't want to make their kids mad, right? They don't want to make them mad. And, I always say, I could handle my kid being mad at me for a few months, even a few weeks, few days. I could never live with myself if I wasn't able to be their parent anymore.
Right.
Right.
Yeah.
So I think parents just need to understand it's okay if your kids are upset with you, if you're keeping them safe. It doesn't mean you have to, sit right on them, but if you're not comfortable and you're not sure, then you're going to keep an eye on them.
So you mentioned safety plan. How does one derive a safety plan? What are the elements of a safety plan? And who should help a parent come up with a safety plan?
Safety plans are really important because it's like a roadmap for parents and kids to know what to do when the emotions are really big. So it's kind of like when I can't think for myself, if I have a tool I can look at to guide me through the steps I need to take to be safe, then I can remember to look at this tool, but I can't remember all the steps, right? And so really anybody can be a part of safety planning. Really super important that, your child obviously is the biggest participant in that safety plan. And it really needs to be something that's meaningful to them. So it's, what are the things that help me when I'm feeling upset? Who are the people that I feel comfortable with that calm me down? So sometimes, even with my own kids, like, maybe I'm a trigger for them when they're really mad. So I should not be the person. Like, maybe they need to talk to grandma or grandpa because I'm going to be the one that's going to just kind of, send them into orbit. And that can also be really hard for parents is, if your child is not choosing you to be first on the list, it's okay. And there's a reason for that. It should not be a peer. It should not be, I want to call my friend and my friend's going to solve my problem for me. Other kids do not need that responsibility of keeping somebody else safe. Certainly they can say, I'd like to hang out with my friend, but there needs to be an adult involved, and the adult needs to be the one managing the safety. So the kiddo needs to be the biggest participant and developer of the plan. It needs to be meaningful to them. It needs to be what works for them, right? So if watching SpongeBob sounds like the dumbest thing on the planet to me, if it's really something that my kid enjoys, and if 10 minutes of that will help them decrease their emotion to a manageable size, I'm going to be fine with that.
Sure.
So who to go to, what coping skills to use. I always, in my safety plans, identify what things are not helpful. So it's super important to know what to do, but it's also super important to know what to avoid. So, gee, Mom, when I'm struggling and you say this to me, that is not helpful. I should know that, right? It should be on the plan. Like, please do not lecture me about all the reasons why I need to feel happy right now. It's not helpful. Also, the kiddo needs to know, like, gee, if usually when you're feeling suicidal, it happens when you're alone with your thoughts in your room, then the last place you should be when you're feeling that way is alone with your thoughts in your room. So you don't have to go to Walmart with me, but I'm not going to have you isolated in your room. You're just going to be out and be around people. You don't have to talk. You don't have to pretend to enjoy it. But I just am not, going to let you isolate alone in your room if that is the place that generally you're thinking these things the most. Other things on the safety plan would be like, what are the crisis line numbers for your area? Sometimes talking to somebody that they don't know at all feels safer than somebody that they're worried about feeling judged by. So those numbers are important to have on there. I'm a big fan of the five senses and identifying like, okay, if I call it the recipe of, colors and feelings, like let's identify what does happiness feel like, sound like, smell like, taste like, and that can be on the safety plan. If I want to increase this positive feeling, wow, and these are the things that help me feel that way, then I'm going to engage my five senses in that way to try to trigger that safer experience. And as far as like who you would share it with, I think anybody involved with your child that your child feels safe with. So it could be a grandparent, it could be a favorite teacher, it could, a church person, any adult or person that they feel like, okay, I would feel okay if this person knew that when I'm struggling, this is what my plan is, and they can remind me of that. So have lots of copies of that plan. Available.
I really love the point you made about making sure you as the parent know what not to do. Like what is going to make this situation worse for your child. And I think that's super important, because that kind of gives them a voice to their feelings. And obviously we don't want to make things worse, but maybe we don't have an awareness of it. So maybe they don't want a hug, maybe they don't want to be touched. And so I think being aware, and listening to your child talk about the things that make it worse is such a good point in that.
So let's say, hypothetically, let's say you have your kiddo and you are going through this process and you are using this process of, being in tune with your child, recognizing when they are upset, recognizing when, they have they're verbalizing that they don't, whatever it is their terminology might be, and you are working through your safety plan, but you happen to see you're having to rely more and more and more on the safety plan. What's the next step to that? What do you do next?
So there's different options. And I think one of the biggest fears for parents and for kids is if they're having suicidal thoughts, they will end up in the ER or on an acute unit or away from their family. And so I think that is a really big fear, and it's a reasonable fear. I think that would be super, super hard. But the reality is there are other things to do, right? So, you can make arrangements if it's hey, maybe sometimes change of environment is helpful. So, and grandma and grandpa are part of that plan. So, kiddo's going to go stay with grandma and grandpa for the weekend. They're not going to leave your son or daughter unsupervised, and they're going to just be engaged with them. If you have an outpatient team, most outpatient teams can support increased sessions sometimes. So I've worked with kids that while, the family is riding the wave with them, we are also riding that wave with them, and we will have increased sessions. I've had kids that I've seen every single day for a week, and it kept them out of the hospital. So I think you just have to rely and reach out to those resources that you have in place. But if it gets to a point where you are providing basically a residential level of care in your own home for an extended period of time, and you are not sleeping, and you, like, if it is that unsafe that you and your significant other, or you and your roommate, are taking turns staying up to make sure you have eyes on the person because it's that unsafe, then I would say it's probably time to go get evaluated at the emergency room to see what supports they can offer. So it's really a matter of length of time, right? So if it's a few hours or even a couple days, that's not, uncommon or unrealistic to be able to ride that wave. But if this is happening every day, for most of the day, for days and days and days, then you really should just have an evaluation. Go to the emergency room. They have crisis response team members that can do a full evaluation and make recommendations. Sometimes it's a matter of they just need to be in a safe place to start a medication or make a medication change, and do it in a setting that provides that 24-hour support so that the mood can stabilize and then go home. So it's kind of a wide range of things you can do. You can get creative, but sometimes you sometimes have to draw the line and say, this is now beyond what we can manage as a family, and we need professional people to provide the security and safety for my child to stabilize.
And I think I think it's really important to identify that, the temperature, like the thermometer, like, okay, where can we manage this? And now where do we need the outside professional help? I'm sorry, Chris, I didn't mean to cut you off.
Oh, no, that's okay. But because I was going to say the same thing, I think it's, just like really staying connected in with that situation and how that child is responding. I'm a strong believer as well that the safety plan is so important, but you have to be willing to follow through with it and be really consistent with it. And so part of the safety plan for us does include the emergency room. And that's terrifying for me. That's not something I want to have to engage in, but it has to be part of the support that I can provide for my children. And we have had to go that far before, and it was huge. It was so important for my daughter to understand that I am this committed to her safety. I am all in. I mean it. I will go to any length, including going to the ER to get an evaluation to make sure that she is 100% safe, and like her overall well-being. And we have had to do that before, but it also, like in our situation, it also demonstrated to her that I completely took her distress and her feelings serious. I wasn't doubting her. There was no like, you'll just get over it, you'll be fine. And that made such a huge impact on her overall. And so she also now knows when I'm like, hey, like you seem unwell right now, and this seems really big. I can tell you're not okay. Like, what are the levels of help that you need right now? Like, am I enough to support you, or do I need some outside help? And she knows, she is confident, like I will go as far as possible to help her. And I feel like that really built some trust with us, where there's that fear, like, oh my gosh, if I'm scared and I drag him into the ER, and because I'm panicked, they'll be so mad at me. Yeah, they probably will, but um, I know in our situation, it showed my daughter, I value you so much. Like, you mean everything to me. Like I'm gonna be uncomfortable. I'm gonna do the hard, scary things. I'm gonna let you be really mad at me. I'm gonna let you hate me right now. Um, because like Tricia said earlier,
Mm-hmm.
I would rather her hate me right now in this situation, or maybe for like a couple days, than for me to not have her at all. Um, and so it's scary, but it makes a big impact on them to, I think, be validated.
Yeah, and I think, the other piece of this is when you think about like all of the steps and what you can do, um, you know, and when we start to have these conversations about, are you thinking about death, and are you thinking about not wanting to be here anymore? And, developing that ability to tolerate those conversations is so important, but it's also important to kind of draw a line in the sand, right? So sometimes, they might say, oh, everything's fine, and you know that it's not, right? And so there might be times where, even though you've got this rapport built with your child and you've talked about suicide before, sometimes they might just be like, no, I'm not telling you, right? And so that's a whole nother level of drawing a line in the sand as a parent, where you have to kind of say, okay, so I'm feeling that there's something up with you, right? And I get you don't want to tell me. So part of the safety plan is, when I don't get a response and you're not able to talk to me, I'm going to just enact the safety plan, right? So, like, I'm going to just kind of default and assume that maybe things aren't okay, um, because sometimes they don't want to tell us those things, right? And so sometimes we have to make those hard decisions, and they might be like, oh my God, you're so, you're overreacting. Well, you know what? I'm just, it's okay. I'm fine with overreacting for a moment. But wow, if you're really shutting down and you're withdrawing from me, and you're shutting me out, then that makes me a little worried. And so I just want to make sure you're okay. So sometimes you have to kind of go that route too, which is also not comfortable. But again, like Kerissa says, I think that when your kids know that you're willing to draw a line in the sand with them and do anything to keep them safe, right? Even when they don't want you to. I can't tell you how many kids that I worked with in the hospital that were so mad when they came in, and they were just never going to talk to their mom or dad again. They hated their guts. This is so ridiculous. And by the time they left, they were so thankful. They were just so thankful. And so parents need to trust that the decision you're making to keep your child safe is a good one, and they will be okay. They might be really mad at you for a bit, but they will get over it, and they will appreciate that you kept them safe when they couldn't keep themselves safe. It might be a while, but at some point they'll get there.
Right.
That's such a good point.
And,
Yeah.
and our main audience, usually, our community mostly consists of families with PDAers. And, a PDAer will default to wanting to be in control of the whole situation all the time. So I really think what you said is a very, very important part. Sometimes you just have to, and we talk so much about letting them have as much autonomy as we possibly can because that's how they feel safe. But with the caveat that, it always, health and safety always come first. So, it's a very, very good point that sometimes, we just have to override that parenting, that PDA parenting that we know, the low demands, let's give them as much control as we possibly can and go. In our family, we say, well, I personally say, I have to do my job now. Like I kind of put myself in a different role where it's like, I know this is something you don't like, and I have to do my job. And as soon as I do my job, whatever that might be, I can step back and then, he has autonomy again. But I think this is a perfect example of when you got to do your job, regardless of how you're trying to support their autonomy.
Yeah, I mean, I think your families are in a harder situation, right? It's just a totally different scenario for your families. I mean, I'm well aware, I've had some great experiences and have really loved the work that I've been able to do, but it is really hard to figure out, like, where is that line going to be, right? Do I want to battle this today? And the reality is, sometimes kids will say things very, like, in a very colorful, extreme way, and because they're just feeling a really big emotion. And sometimes when they say those things, they also need to understand, if this is the way you're choosing to tell me you're having a really big emotion, then I have to tell you that when you say this exact thing, I have to have a really big response. Right? So it's a line between understanding what are they really trying to communicate. Is this suicidal ideation? Is this just a really big feeling? Teasing out like all of those in betweens with your families is super, super hard, right? Because we also have to take, those statements very seriously. So, the talks that I might give a family that doesn't, have this experience that you all have is different because you have all these other layers that you have to kind of wade through with your child. And like you said, do your job, but also like show up for them and like keep them safe. And also, respect the fact that these demands are triggering. And so you've got all of these other things at play. And I think that is what causes a lot of your parents to really question and second guess everything that you do.
Yes.
I mean, it's just this, like, did I do the right thing? Am I doing enough? Did I cause this because I put a demand on my kiddo? And the reality is, no, you are doing a great job. You're doing a really hard job, but you are doing a great job. And sometimes doing a great job is messy and loud.
Yeah. Well,
yeah.
And I think part of where this difference between, suicidal ideation and like how serious is of a situation, and trying to figure it out is because as parents and PDAers, we are very often just experiencing very, very large reactions. And it's almost always a big reaction. And I think that's because they really do feel so intensely. And they honestly are so overwhelmed that by the time, it comes out, they do get into that feeling of, I can't handle this and I just wish I didn't exist. And so trying to always like keep measuring, is this a big reaction because they're extremely anxious, they're extremely overwhelmed, or has this crossed over into something maybe more serious, that needs like a different type of support, because we often have, you know, we're like cruising right here and it's kind of fine, and then all of a sudden, she's up here, and so for me to try and go, okay, like where are we at, on
Mhm.
this when you don't want to exist, like, and that's where I learned to try and say, what does that look like for you, what does that mean for you, and and so sometimes it is like this right here right now is just way too hard for me, and but we did have a period of time where it took a much seriouser or more serious, um tone, um and we started to hear this same, like, I just can't do it anymore, I just can't exist, I don't want to be here, and we started to hear that way more consistent, and I had to, every day we were going, trying to pick through. And then eventually I had to say, like, okay, you are saying really, really big, serious words with very big emotions. And I now have to take an equally as big reaction. And that's how, like, we ended up taking our safety plan all the way to the end, to the ER. So it is really hard to figure out when this is a really, really big PDA emotion, or when it's really serious. So kind of explain what would be some of those red flags of, this is like crossed over into very serious, and it's not just like super big emotion, I don't feel good, I'm overwhelmed.
So there's a lot of different factors in that. And so one of the biggest factors is this person at imminent risk to harming themselves? And so when we think about imminent risk, we think about frequency of thoughts, intensity of thoughts, the duration of their thoughts, and do they have a plan? And do they have access to whatever it is that they plan to do, right? So um, I worked with an autistic person one time, and he was really mad at a teacher or something. And he would always make these like really giant, like homicidal statements, right? And so the school's reaction was like, kick him out, he has to
Mhm.
go home. He's making
Mhm.
statements. And it's like, okay, well, tell me what you mean, right? So tell me what your plan is. Well, it was totally outrageous and not even something that even, some very skilled homicidal person could carry out. I mean, it was just like this outrageous, otherworldly, put him on a spaceship and send him into Jupiter. And like, that's not going to happen, right? So you're really mad at this person and this is your plan. Do you have access to a spaceship, right? Like, are you going to be able to shoot the guy into space? Probably not. So, do you have any other plans? No, that's just all I want to do. Okay, well, so, I'm not going to get as freaked out by that as someone that might say, I'm feeling really suicidal and I am thinking about, going downtown and I want to jump off this building. It's actually this specific building. And oh, by the way, I'm actually have made arrangements to like get a ride from a friend down there this afternoon to do that. That's different, right? So That is very specific. Kind of the steps are in motion to carry out the plan. Also, like ambivalence about death and dying. Like, tell me how you feel about the idea of death and dying. Does it scare you? I get real worried when people say, no, it kind of doesn't. I'm not going to care because I'll be dead, versus, yeah, I've thought about, suicide, but I just can't even think about actually hurting myself. That's just, I can't do it. It doesn't mean their thoughts are less important. It just means kind of their ambivalence about following through with it is in a different place. So someone who has a real detailed plan is really ambivalent about death and dying. Somebody that has gone through something, especially adolescence, like friendships ending, breakups, feeling rejected by their peers. So if there is some kind of big event like that, I might be a little more like, okay, I'm going to, this is on my radar now. I'm going to maybe ask more questions. If somebody says, I think about it all the time, and even when I follow my safety plan, I cannot get the thoughts out of my head. And and I really feel like I don't know that I wouldn't follow through on it. So if they don't trust themselves, if all of those things that have worked before stop working, if they start to become pretty ambivalent about life and death, if they start kind of talking about, like, let's say they're really connected with their animals. That's a big one. Especially with teenagers. If they have an animal, a lot of them will say, when I ask the question, because I do ask them when they tell me they're suicidal, and if they have a plan, I always ask them, what keeps you from doing that plan? And if they tell me a list of things, my pets, my sister, my friends, that's different than, I really don't have any reason why I shouldn't do it. So there's a lot of layers and a lot of things to look for. And certainly parents should not put it on themselves to be the evaluator of imminent risk, right? So that should be done by a professional. And so if you are at a place where your child is saying suicidal things and they're telling you, no, I really do feel like I want to die and I really can't do this anymore, and I think about it all the time, and you've tried the safety plan and it doesn't seem to be working, I would say then that would be a sign that they need a professional to evaluate imminent risk and assess the plan, the intent, the access to means, all of those things, and just get an evaluation. But don't put it on yourself as the parent to know all those questions to ask either.
Mm-hmm. Is that something that I know not recently, but in the distant future, no, what am I trying to say? I don't know what I'm trying to say. The National Suicide Hotline is what I'm trying to say. Mm-hmm. Is that something that a parent or even someone who is, having these thoughts can access, and somebody else is on the other end of the line that can help assess I don't want to say severity. I don't know what the right word might be, but how, if it's imminent or if it's something that, is not imminent.
So there are some tools that are evidence-based. And so pretty much if you go to an ER, mm-hmm. they're going to know how to do that. So there's it's called the Columbia Suicide Risk Assessment. And it really is very accurate in identifying low, medium, or high risk to follow through with a plan to hurt themselves. And so I recommend, if you're questioning or you're not sure, if you go to any ER, even a pediatric, your primary care physician, a lot of those people are trained in how to do it. Nurses know how to do it. There's actually a website you can go to and watch a video and learn about what the tool is and how they kind of decide, what's an actual plan and what's an actual attempt versus, a passive thought and self-harm and things like that. So, but certainly if you're somebody on the other end of the line on a suicide hotline, you've likely been trained in those things. In fact, we even have a crisis phone number for all of our outpatient people that they call in. And one of us, in fact, I'm on call this week. And so we all have been trained on all those questions to ask. And really, when those questions are asked, it just tells you, okay, we need more intervention or we don't. So if there's ever a question, you should just go to the emergency room and get evaluated, because they're going to ask all of those things and they're going to be able to tell you this kiddo's really high risk. And your child might be more willing to tell somebody else than you all of those things, because that's a really vulnerable thing to share. Like, nobody wants to admit that, I have thoughts of overdosing and, and this is what I would do. Like, that doesn't feel good to say out loud, because when we say it out loud, it gives it a different kind of power and we can't take it back. And so kids often don't want their parents to know the plan, because it can be really traumatic for the parent to hear the details of those thoughts.
Right.
Did I answer your question?
Yes.
I feel like I kind of rambled
No,
around.
you didn't. I mean, considering how long it took me to get the question out and to use the right words to ask the question, no, it was a beautiful answer. Thank you.
Yeah.
And
so
I think the other piece of this that's really, really important is there is a website, and it's called Zero Suicide, and they have a number of different kinds of toolkits for parents, for teachers, for organizations, lots of different toolkits on how to have conversations with your kids about suicide. It talks about, I think there's a link on that links you up to a training called Counseling on Access to Lethal Means. And so it talks about the importance of limiting access to guns. And even if you just store the ammunition in your gun in a separate place, or having a lockbox for your medication, and just, how powerful it can be if somebody has to take an extra step to get into those pills. You're giving them this much time to make a different choice. And it's been proven to be effective. And so that kind of stuff is on their website. And I think it's really, it's just a great resource for parents and for people that, work with people who might struggle with those thoughts.
That's such a helpful tool for parents, and we'll make sure that the link for that is included in the podcast description. Equipping yourself as a parent and knowing these things, what to look for, what are the safety precautions, that you can place in your home, what are the crisis response options where you are. Some people are like, it can be really hard to go to the ER, especially when you're dealing with an autistic child. They're going to struggle with sensory and communication. So then add on to that, the high anxiety with PDA, that can be really, really scary. Especially as a parent, if you fear you as the parent are not going to be heard. So I think knowing what your other options are for where you live, and it's different everywhere, is a really important step in this. I think having a mental health professional already involved in your life, it is so important, and it makes a big difference. And for me to know that I I just have like the office, and I can call, and I can, that there's someone there who knows my child, and I can ask some questions. Um, Even if we're not to that, high crisis point, but just being connected in with mental health professional, I think that's really super important. And having like one more trusted person in your life, like that's really important to have established. That way, when you do hit that crisis, you already have some stuff um, in place. I love the safety plan. It's something that I share about a lot. I think it's really important. It's made a huge impact in my family, just for me, to know, what are my steps, what is my fallback, like what are my options. And so I always really encourage people to make sure that they have a safety plan, that they know what it is. And especially with a PDA, that kid needs to be involved in creating it and understand the steps. Because there's been points where, my daughter is having big feelings and she is really upset and distressed. And I can kind of remind her, okay, like we're gonna have to start going into the safety plan. And that kind of gives her an outline of what to expect. And so I think getting that established is really important. um, i I think having a mental health professional be able to put that safety plan together is super helpful, especially with PDA, because anytime you can kind of like put that onto like a higher power, like I got to kind of like put that outside of me. Like, I didn't make this. I'm not making you do it. And so I think that's a helpful way to get a safety plan for PDA. And so my daughter she knows what the safety plan is. She knows what it entails. And so she kind of it almost gives her the choice of like, I know what the next step is, and maybe I actually don't want to go that far. And I can see her then try to engage with me in co-regulating and that type of a thing so much more.
So one thing about the safety plan is sometimes people create them after a crisis. So I encourage people, make your safety plan when things are going well before you get to the crisis. So a lot of times it's, oh, we had a crisis, let's develop a safety plan and now follow it. No, no, no. Let's talk about what it means to be safe outside of a crisis. Let's talk about what it'll look like when we start to implement the plan when we're not in a crisis, so that when we're in the crisis, we just already have it done, right? And so that is something that's really key, is do it ahead of time. Don't wait for the crisis. Everybody needs a safety plan. It's better to have it and not need it than need it and not have it, right?
Yes.
So always try to do that before a crisis. Don't wait for a crisis to do one. Super important.
This was just so much fantastic information. It's so much, I feel like, encouragement and reassurance as far as a parent in, how to really approach this. I absolutely just love opening up this conversation and being brave enough as a parent to just even approach the subject with your kids. Um, I think that's so vitally important just your kids can know before things are tough that this is something that we talk about, and that it's a subject that is open in our family. And so Tricia, thank you so much for taking the time and bringing such a tough topic out into the light.
Thanks for having me.
Absolutely. Thank you. And it was very nice to meet you.
Nice to meet you as well.
Yeah.
Okay, so if you would like to learn more about pathological demand avoidance profile, you can find us at journeyswithpda.com. And you can always reach out to us or email us if you have any more questions about PDA or the autistic experience. We do have our bi-weekly free PDA support chat that we do to help bring more understanding and awareness to PDA. So you can also find us on most of the social media places.